Tell me a little bit about kind of the dynamics of your practice currently and how that is playing out day to day.
Yeah, definitely. So we know that there's basically four different models of anesthesia delivery, right? The two team models that we have is supervision and direction. So whenever we do have the staff on site where I'm at now, we work in a medical direction where we have an anesthesiologist. He'll do the preoperative exams for us and maybe do a PACU, write the order set for them. And then the CRNAs will actually perform the case. And then the anesthesiologist is available for emergencies. So we'll function in that capacity maybe 70% of the time. But since there's so many surgeries and we don't have enough staff, we have to kind of go to a hybrid type of model where we have the anesthesiologist running his own room and the CRNAs will run their own room. And the CRNAs will be responsible for the entire day, the pre-op exam, taking them back, doing all the post-op orders, which is a lot more work. Can we do it? Obviously, but it's a lot more work on our end whenever you're trying to do all these things and then go see another patient and get them squared away while still trying to be efficient with your time. And so, yeah, I think it's a pretty unique situation. I enjoy it because I do want to kind of function in that independent role sometimes and still be able to, get a full exam on my patient. And then the CRNAs here are on call. So the anesthesiologist, they don't take call, just the CRNAs do. So anything after hours, will come in and pretty much run it independently. And me being fresh out of school, that's exposed me to a lot of situations where, you really have to talk to these surgeons. They just want to cut, man. These
Yeah.
guys just want to cut. The person's heart's not working. If the heart doesn't work, then we can't get through surgery. And sometimes, you got to sit down and really have good conversation with them with that. So being a new CRNA, sometimes those conversations can be uncomfortable and, people are going to be upset at you. But at the end of the day, we're advocating for our patients.
Yeah. I know that it's not unique. Those are the kind of the models they ran in California too. Not only unique to Dallas or the Texas area. There's just such a dearth of anesthesia providers in general that there are like you said, the medical direction during the day, and then at nighttime you switch to a hybrid model in order just to
Mhm.
cover the amount of emergencies or the surgeries that are going overtime, essentially past when everybody wants to go home, whether it's 5 o'clock, 7 or 3, depending on your practice. And so that has changed the dynamics. Of anesthesia in general. Now, is there a model you prefer, one versus the other? If I put a gun to your head and said, "Hey, Cordero, tell me which one you prefer 3 months out of training?"
Right now, I enjoy the model that I'm in right now, but I can't appreciate a good ACT, just because it offloads a lot of the work. We work as a team, like you said, as long as there's good communication there, and whenever I'm working with the anesthesiologist and the pre-op exams done, he's like, "Hey, we have these issues, and this is what I think we can do." I think that I love it. I love the teamwork aspect of it, but then I do appreciate the being able to come in and do the independent thinking as well. So I like the model I'm in right now. I like the hybrid model. I think eventually I'll probably end up going out doing locum somewhere, a little more independent practice, but I'm good where I'm
Yeah.
at right now.